Dental implant placement is a procedure we use in dentistry to replace your missing teeth that are not savable, that are not restorable, restore your chewing function, it restores your smile, give you that confidence. It starts with first whether the tooth that we are replacing is actually savable or not. If you're in a good health, if you're a non-smoker, your bone is really healthy, there is no gum disease involved, then that's the ideal situation where we can use dental implants. Person with a severe gum disease, it's not a good idea to place implant because we know that it's going to fail sooner or later. Dental implants are made of titanium and zirconia. Those are the best material that your body doesn't reject. There's one part we call it fixture, which is the one that goes into your bone. It looks like a screw. Then we have an abutment that attaches the implant with the crown that's put on top. So there are like 3 different parts. If you have a single tooth that's missing, fracture, or we cannot save them, we call it a single unit implants to replace one single missing tooth. Then there is where you have most of your teeth in your mouth, but 2 or 3 teeth are missing. We place 2 implants that can work as an abutment for a bridge. For patients who are missing all of their teeth, for them we can just make dentures that are customized to your mouth and they are supported by those implants. If we can place the implant the same day of extractions, then we are waiting for about 3 to 4 months for that implant to heal, and then we can just go and put a crown on it. If we extract the tooth and we have to prepare your mouth for future implant placement, it's almost 6 to 8 months to make sure the bone is ready to receive the implant. So when the tooth is taken out, not only the bone starts remodeling and resorbing, but the teeth start shifting. If you want to replace that tooth sometime in future, additional ortho treatment will be required to move teeth in a proper position. The color, the shade, everything will be matched to your existing real teeth to make it look seamless. We can place the implant the same day. If it's an infected tooth, then we have to deal with that infection first. In that case, we prepare your bone to receive that implant in 3 to 4 months. A way for your gum tissue to heal around that screw. We either send you home with a healing abutment, is what we call it, or we can put a temporary crown on it. Either ways, we are not using that crown or implant for chewing or biting at this time. The first 24 to 48 hours, you're not supposed to brush your teeth. Diet-wise, there will be soft diet, and then make sure you come back for follow-up. Cost of the implant varies depending on how many implants are placed. If it's a single unit implant, if we are putting a bridge, if it's all on X procedure, but we have some financing options for you. The procedure is seamless, very comfortable. You are numb. We use nitrous oxide sedation if it's needed. Otherwise, the whole procedure is done with under local anesthetics. Anything that make you comfortable, you know, the pillows, the blanket, playing some calm music.